This is Jenna Kahn. I just wanted to give an overview of radiation oncology residency. It's through the NRMP mean match system. The first year of your intern year usually looks like a transitional year or a preliminary year. That is where you're either, a preliminary year would be either medicine, surgery, you could do pediatrics, and then a transitional year is kind of a mix and mash of different rotations throughout the year as an intern. Then you go into your radiation oncology residency, which is 4 years. There are no ACGME accredited fellowships, but there are some fellowships throughout the country, and it is not necessary for a job, but some do like to do a fellowship, such as in brachytherapy or pediatrics. Radiation oncology is the only oncology specialty that is a residency and not a fellowship. It's also the only oncology specialty where you become certified in treating all types of cancer, from pediatrics to geriatrics. This is the data from the NRMP website, looking at the data from the 2018 matched allopathic seniors. The mean USMLE step 1 and step 2 is around the 240s and 250s. The mean number of abstracts, presentations, and publications around 15 to 16. About 20% have PhDs and 20% have another degree. Although these numbers do look scary to some, this is not necessary. And if you are passionate in radiation oncology and interested, you will find a way. There are, in 2019, there was about 86 programs and 192 positions, so competitive but achievable. About 93% of seniors matched into that preferred to match, did match into radiation oncology. The data from 2020 kind of gives you an idea from 2016 through 2020 of how many positions were offered. And that position, I said that in 2019 there was 192. That number did go down to 175 this year in 2020, but the number of applicants has also kind of gone along with that. So what does residency schedule look like? You might have brachytherapy or procedures on Monday. On Tuesday, you might have new consults or inpatient emergencies. On Wednesdays, you might have consults and follow-ups. Thursdays, tumor board, maybe some more brachytherapy, maybe some follow-ups. And Friday, you might have an academic day and another tumor board. And then you take into consideration that you're also spending time doing contouring, reviewing plans, seeing your on-treatment visits during the week, as well as didactics, including education in disease sites, as well as physics and radiation biology. And then going over the treatment fields that you're treating of your patients. So at OHSU, we have 6 total residents. They do 3-month rotations. They get 6 to 12 months of research block, and in that time, you could do a MPH if you'd like. You can do away rotations. They're not required, but you could do them in pediatrics or brachytherapy. And other institutions are happy to have you during those times. During your PGY, at the end of your PGY 4 year, you do physics and radiation biology boards. At the end of your PGY 5 year, you do clinical written boards. The first postgraduate year after you finish residency, you do your oral boards. So how do you get involved in radiation oncology? You can come and shadow in clinic. You can go reach out to any physician or that you're interested in spending time with. You can come to chart rounds where we do the peer review of cases. You can get involved in research projects. Sign up for an elective rotation during your 3rd or 4th year. And Arrow has a great website for more information on different opportunities. And there is a great paper on a review of available opportunities for medical students to prepare for the career in radiation oncology by Ankit Agarwal. Other resources for you to check out, you can follow at OHSU RadMed on Twitter. We also have a very active website and student interest group website. Arrow, Association of Radiation Oncology Residents, has a medical student corner, and there is career application and residency interview FAQs and webinars and more. So you could probably spend a good amount of time looking through that website. There's also an Arrow Facebook group as well as a Twitter account. ACRO is also a great resource, ACRO, and they also have a website and Twitter account. You have already watched some of the wonderful videos from the Radiation Oncology Education Collaborative Study Group, but checking out their website is a great opportunity to look at different resources that are available. And then there is econtour.org, where there's interactive 3D contouring cases. If you're interested in social media, there is more to follow with the Society of Women in Radiation Oncology, as well as Rad Onc Women Docs, and many more. If you have any further questions, I'm always happy to spend time to answer them. Please do not hesitate to reach out. Thank you.